My name is Morgan, and my informative speech is about the jobs that a chiropractor's assistant does on a daily basis. Did you know that there is a larger amount of hustle and bustle that goes on in a chiropractor's office than just cracking and snapping? As an assistant of a chiropractor, I know what goes on behind the scenes. Not many individuals know that these physicians have assistants, let alone know what goes on in the office besides being adjusted. It is important for people to know the extension of a chiropractor's office in case they want to be seen by one or they refer someone to be seen by them. I myself am a chiropractor's assistant, and I have been appropriately trained to carry through the tasks that are necessary to be one. As an assistant, I fulfill many tasks during the day. The most important are the therapies that I perform on patients. I also help the doctor with his own patients, and I assist in the office. I will start by going over the most important roles of a chiropractor's assistant, and that is the therapies that I perform. One therapy that is performed is ultrasound therapy. Ultrasound therapy works by massaging a little ultrasound wand on the patient's problem area, which could be their shoulder or their lower back. And it helps by breaking down inflammation and scar tissue. The intensity of the ultrasound machine can be turned up or turned down to focus on different muscles of the body. Where muscles are bigger and less sensitive, the intensity should not be too high, but for muscles that are smaller and more sensitive, it shouldn't be too low either. A patient may not always feel the ultrasound machine working, but it's working. Another therapy that I perform is acoustic wave. It's basically the same thing as the ultrasound machine, except it uses sound waves to break it up, and it's a little more intense. Some patients don't like the sound of it because it sounds like a jackhammer and it's very loud, especially if the therapy is being done in the CT junction or in the neck area. It's right by your ear, so it does get pretty loud. And it does take time to get used to. Most patients can't just start getting the acoustic wave instantly. It takes time to build up to that level pretty much. The next thing I'm going to talk about is how I help the doctor with his patients. Besides working with my own patients, I also assist the doctor with his patients. One way I help the doctor is updating patient procedures and complaints on our documentation system. So if we do deal with a lot of car accident patients, and they have numerous complaints. It could be their neck and their upper back, and then it could be their lower as well. And sometimes as we go through the therapies, we help make the worst area better. So as they proceed with their therapies and their appointments, the next time that they come in, they may not have as bad of pain in their upper back as they did last time. So I generally follow the doctor into his treatment room, and as he's talking about new techniques he's trying, I begin to type them into the patient's chart. That way we know for next time what he tried and what he hasn't tried yet. I also keep an ear out for anything the patient may have to say while they are speaking with the doctor. Anything that the patient says is noteworthy. If they took the time to explain it to the doctor, then it needs to be charted in their online documentation. Another way I assist a doctor is by turning over his room and bringing in the next patient. So when he finishes with one patient, as he sees that patient to the front desk and they check out, I'm cleaning the table off, I'm taking the paper away that goes on the headrest of the table, and I'm making sure everything is tidy, and then I go grab the next patient for him so we can keep the ball rolling. It doesn't always work out that smoothly because sometimes the doctor has to speak with the patient privately or needs a little extra time, but overall the system works pretty well. The last thing I'm going to talk about is the office tasks. There wouldn't seem to be a lot of office tasks for us to do since we're more hands-on. We like to work with patients more. But We have to deal with insurance, we have to deal with attorneys, especially if they're in a car accident. When we deal with insurance, we have to call the insurance company and we have to let them know that the patient's being seen with us, and we have to ask about benefits. And if they are a car accident patient and they have an attorney, then we have to let the attorney know that they're being seen in our office. And then another responsibility that we have is scheduling patients. So each patient has an allotted time depending on the therapies that they need to help them feel better. So sometimes it's 30 minutes and sometimes it could be 45. It just depends on if they need the works, which would be ultrasound, acoustic wave, manual therapy, adjustment by the doctor, and muscle stim, or if they're just getting 1 or 2, they shouldn't have that much time scheduled for them. So with all that information that has been given, I can review for you. There are numerous tasks a chiropractor's assistant tackles during the day, with the most important responsibility being treating patients and their needed therapies. We also assist the doctor and do office work. But we're not the true superheroes because we cannot fix patients with just our hands. Thank you.